A sincere welcome to some of our community participants this morning. We have a number in the audience, so I appreciate that you're here as well. We'll start out with a reflection, and then I'll carry on with the normal business. This is a reflection that many of you may have heard, but I think it bears repeating. It is a good reminder about cautioning us about perceptions and how far we take them before we know what the truth is. This is called The Cookie Thief. A woman was waiting at an airport one night with several long hours before her flight. She hunted for a book in the airport shops, bought a bag of cookies, and found a place to drop. She was engrossed in her book, but happened to see that a man sitting beside her, as bold as could be, grabbed a cookie or two from the bag in between, which she tried to ignore and avoid a scene. So she munched on the cookies and watched the clock as the gutsy cookie thief diminished her stock. She was getting more irritated as the minutes ticked by, thinking, if I wasn't so nice, I would blacken his eye. With each cookie he took one too. When only one was left, she wondered what he would do. With a smile on his face and a nervous laugh, he took the last cookie and broke it in half. He offered her half as he ate the other. She snatched it from him and thought, ooh, brother, this guy has some nerve and he's also so rude. Why, he didn't even show any gratitude. She had never known when she had been so galled, and sighed with relief when her flight was called. She gathered her belongings and headed to the gate, refusing to look back at the thieving ingrate. She boarded the plane and sank in her seat. Then she sought her book, which was almost complete. As she reached in her baggage, she gasped with surprise. There was her bag of cookies in front of her eyes. If mine were here, she moaned in despair. The others were his, and he tried to share. Too late to apologize, she realized with grief that she was the rude one, the ingrate, the thief. The power of perception. So you have a number of things on your table this morning that I'd like to call your attention to. There is a sheet that looks like this, talking about our next session, which is about primary care redesign and the work that we're doing there to pilot different ways of delivering primary care. There's also a yellow sheet that is a comment card. Every month I stand up here and tell you that I appreciate your feedback, and I sincerely do. We make changes to the sessions based on what you tell us, so please continue with that. And there's also a green slip. If you're interested in a chance to win the prize that we have later this morning, please fill that out, and Katie will be around later to pick them up. So with that, we have a great program this morning, and it's with pleasure that I'm able to introduce our presenter, Dr. Troicki. Dr. Troicki is a radiation oncologist with us at Agnesian Healthcare and the Agnesian Cancer Center. He cares for patients right across the parking lot here, along with fellow radiation oncologist Dr. Vanderkoy, who many of you know, our newest radiation oncologist, who Dr. Troicki will introduce, Dr. Liss, and our medical oncologist, Dr. Lundberg and Dr. Jones. So Dr. Troicki is a graduate of Drexel University College of Medicine, and he completed his radiation oncology residency at Hahnemann University Hospital. And with that, I think I'll turn it right over to you.
Okay. Thank you. Thank you very much, Holly. I don't know if I need a mic. Do I project well enough for the people in the back? I usually prefer to use my hands, so I don't want it flailing at you. My name is Filip Troicki, for those of you who do not know me. I know a couple of people in the audience, certainly. But I'll give a talk, but first of all, I wanted to introduce my new partner and a new face to the Cancer Center, and certainly a sigh of relief for myself and Dr. Vanderkoy, as we have been really very, very busy at the Cancer Center for the good and for the bad. But Dr. Liss has been a wonderful addition for us, and like I said, he really took a lot of work that over the summer and through the spring, Dr. Vanderkoy had on our plates, so we are really very grateful. And I just wanted to introduce him, and maybe he can say a couple of words where he's from, and etc.
Sure. Thanks, Filip. We just thought this was a good opportunity for me to get myself out there and meet a lot of you. I just finished residency at Michigan about 3 months ago now. I've been at the Cancer Center for 2 months. I'm originally from Wisconsin, so you don't have to worry about me being a Michigan fan or Lions. My wife is from Anago. I'm from just south of Milwaukee in Franklin, and we have 3 girls, 6, 4, and 18 months. And our family's really enjoying life in Fond du Lac, getting into a lot of different activities. I've been thrilled to take care of patients at the Cancer Center and work with Dr. Troicki, Vanderkoy, and medical oncology, Dr. Lundberg and Dr. Jones. Then the whole Cancer Center has really been great. I look forward to seeing a lot of you around the floors and around the hospital. And at any point, if you have a question about anything related to cancer or any one of your patients, please don't hesitate to let one of us know. We're always happy to chat. So I think I'll leave it to Dr. Troicki to talk about cancer prevention through exercise.
Okay, thank
All
you.
right.
Thank you, thank you. All right. Well, first of all, thank you so much, everybody, for coming. I very much appreciate it. And I'm kind of an animated speaker, so I, again, apologize. I may be walking back and forth a little bit. And Holly started with a reflection. I also would like to start with a reflection a little bit about yourself, okay? And I want you to maybe close your eyes and imagine which superhero you are, okay? I want you to think about what kind of a superhero you would like to be and what you are. Are you Batman, where you work nights and basically people see you in the shadows? Are you Spider-Man or Spider-Woman that basically goes from floor to floor and 6th floor heights do not scare you? Are you Superwoman, Superman? But basically, no challenge is too big. What kind of a superhero are you? Okay. Put that in your mind's eye. And I also want to thank you for being that superhero. I know that Steve Little thanks you for being that superhero, and everybody else, your patients do. And I want to thank you as well. And the reason is because you guys do things, everybody does things, whether you're in administration or you're nursing or anywhere else, or whether you're a spouse, a mother, father, whatever it is, brother, sister, friend, you have so many roles to fill, so many shoes to fill, so many people that are relying on you and are looking at you and saying, what a wonderful job you have done. Maybe they're not saying it out loud, but I bet a lot of people are thinking it. I am very fortunate because a lot of people do thank me for the work that I do, but I have a very difficult job in a sense, in that I work at the Cancer Center and I work with cancer patients. But it's probably the best job in the world. And I wanted to talk to you guys about cancer prevention through exercise. Now, I'm not sure whether I'm speaking to the choir here or not, but as we talk about cancer and as we talk about exercise and as I talk about how cancer can be prevented through exercise, think about your role and how you may fit into that picture, okay? A little bit about myself. Although there's information in here, I'm not a type of speaker who's informational. I'm more of a motivational speaker. So hopefully everybody will get a little bit motivated in regards to what I have to say. And at any point in time, if I see people falling asleep, I will start throwing things because I don't want this to be nap hour. You took an hour away from whatever you're doing to hear me talk, so I want it to be actually one of those things that you come away with a little bit more energy and ready to hit the floor running, and exercise is going to be one of those things. Okay, my talk starts with cancer, okay? We've all heard the word, but maybe not all of us realize where that word comes from. And when cancer was introduced, cancer is actually a brief history of cancer. It is old. It is as old as we are and older. So basically, the earliest descriptions of cancer was written in 1600 BC in some Egyptian writings. And it's very, very interesting because cancer really hasn't changed for those millennia. Okay? It's the same cancer that I'm treating that the early Egyptians saw, and they didn't really know how to treat necessarily. But in some of the writings, they described ulcers of the breast, obviously most likely breast cancer. And they described it as disease that has no treatment. Okay, luckily, we live in an era that I can talk to you guys about treatment, and I can talk to you about cure for a lot of these cancers, or at least palliation and treatment and things like that. The interesting thing was that a temporary treatment was with a fire drill. Now, I don't mean the fire drill where you stop, drop, and roll, that type of fire drill. I mean cautery. This, basically, what we use in the OR today is what the Egyptians used 1,600 years before Christ with cautery. So, although we have moved very, very far, surgery still uses the same tool. So the next time you're in the OR and the surgeon asks you for the cautery, you can ask them, do you mean the fire drill? So the word cancer actually came from the father of medicine, Hippocrates, who lived 460 to 370 years before Christ did. And he is what we call the father of medicine. He's the guy that looked at the human body and said, you know, there's a healthy body and then there's a sick body. And he looked at diseases a little bit differently than people did. And he termed the word cancer, carcinos is what he called it. And it basically means a crab, okay? Veins stretched out on the sides like a crab, kind of like this. That's what he saw, that's what he described. So he basically said, oh, well, I'm going to coin this cancer, or carcinos. And interestingly enough, because this is a talk about exercise and cancer, this is what Hippocrates said. If we could give every individual the right amount of nourishment and exercise, not too little, not too much, we would have found the safest way to health. Okay? This guy knew this. This was the first guy that wrote like the first medical book ever. Okay? So he talks about nourishment and exercise. He doesn't talk about surgery. He doesn't talk about radiation. He doesn't talk about chemotherapy. He doesn't talk about pills. He talks about nourishment and exercise, which I think, you know, so my talk today dates all the way back to what Hippocrates said. Okay? Then there was another guy called Celsus. And Celsus lived a little bit later. He actually lived during the time of Christ. And he was a Roman. And he made the first encyclopedia, first medical encyclopedia. He put it all together. An 8-volume encyclopedia of medicine. So basically, what he saw, he would record and he would talk to other people. And he translated the word from Greek, carcinos, to Latin, cancer, and that's what we use right now. But interestingly enough, he also had a quote, okay? So he wrote, live in rooms full of light, avoid heavy food, be moderate in drinking of wine, take massage baths, exercise, and gymnastics. I don't know how he separated gymnastics from exercise. Fight insomnia with gentle rocking or the sound of running water. Change surroundings and take long journeys. Strictly avoid frightening ideas. Indulge in cheerful conversation and amusement. Listen to music. And this guy was smart. But you can see he said gymnastics and exercise. So it's not even enough to do exercise. You should probably undertake some gymnastics. So again, really smart guys. And they already saw the power of exercise as important for our health. Okay? And again, I may be preaching to the choir here, but all of this you can take back with you to whoever leads a sedentary life. And if you do have insomnia, maybe just run some water. So what about modern medicine? You know, these guys were talking about fire drills and things like that. Well, I got this, I think it was before World War II. It came out, and basically this was a poster that said the only safe weapons against cancer are surgery, x-rays, and radiation, okay? Do not trust your life to other methods, okay? Which we now know that basically you have to also include chemotherapy in this because our chemotherapy colleagues would get upset. But, you know, this is the world I live in. X-rays and radium, the surgeons are very, very important in this, okay? But that's modern medicine for us, okay? Some things have changed, some things have not. So, in terms of new cancers, everybody's aware that cancer is a big problem. And it's a growing problem because of a growing population. And you may think to yourself, well, I think more people are having cancer. And some of that is true, but it's usually because of early detection. Okay? We can actually find the cancers. A lot of people used to die of other causes, and then on autopsy, if an autopsy was done, they may find an incidental finding of cancer. Now we have a lot of screening methods. So although the perception is that cancer is actually more prevalent, there's more of it, it may or may not be true. Okay? So this is the world map. So in the United States in 2015, 1.6 million people will be diagnosed with cancer. That's a lot. Okay? So in terms of exercise, okay, there is some strong evidence for some cancers, and there's some good evidence for other cancers that it can actually be used as a preventive tool. Okay, the strong evidence, and I'll kind of go through this a little bit: breast, colon, and rectum, esophagus, pancreas. There's good evidence for endometrial, lung, prostate, and kidney. This basically makes up half of all of our cancers. Half of the cancers that we see are on this board. The most common, obviously, in male being prostate cancer. The most common in females being breast cancer. The number one mortality being lung cancer. Okay, and I'll show that in just a little bit. So this is cancer death. It only goes up to 2011. It comes from government statistics. The interesting trend that everybody kind of looks at is, oh my gosh, look at this. Lung cancer is really risen, and now it's on the decline. I just read an article from JAMA that came out just this past weekend that actually it's now starting to head back up. And the reason for that, and I gave a talk, I guess it was 2 weeks ago, about e-cigarettes. And they're saying that now kids are picking up smoking, so this trend is going to probably go up because of e-cigarettes. So don't expect this trend to go down. It's probably going to level off and may actually start going up. Prostate cancer deaths are going down because of early detection. All of the cancer deaths are going down because we can actually treat these patients, which is a really good thing. Okay. In women, same thing. Okay, a little bit less lung cancer, although has not had that steep of a decline, which is very, very interesting. And breast cancer is also on the decline with early detection. Not as many women are dying of it. Okay, so I know you cannot see this slide, and that's fine. But I just wanted to point out Wisconsin, where we're at. Okay, for all sites, new cases in 2015, about 32,700 new cases of cancer. That means all cancers. Okay, female breast about 4,300, cervix is only 190, colon and rectum 2,400, uterus about 1,100, leukemias about 1,200, lung 4,300. Okay, very similar to female breast in Wisconsin. There's a lot of people smoking. Melanoma is also a problem, 1,300. Non-Hodgkin's lymphoma, 1,400. Prostate cancer, 1,310, which is exactly the same number as for female breast, which is also interesting. And then urinary bladder, 1,600. Okay. So these cancers that I circled are the strong evidence that that we have found that exercise actually can reduce the risk for developing these cancers. And I'll go over how that was discovered. But that totals about 16,600 cases each year that could potentially be reduced the risk. Now, I don't want to say complete prevention because there's other factors at work here that may cause cancer, but to reduce the risk. Okay, and then estimated deaths. So these are what we call incidence numbers, meaning new cases. This is how many people will actually die of these cancers. So about, in Wisconsin, 11,550. And then there's other cancers that kind of take over. But The cancers that can be decreased with exercise are these: female breast 720, colon and rectum 850, lung, again, the big killer here, okay, 3,000, prostate 590. So a total of 5,210. That's still a lot of deaths for Wisconsin, okay? So, leading cancers that we see overall, okay? New cases, I mentioned prostate and breast. They're kind of the most common cancers that we see over at the Cancer Center. But lung is a huge one too, and we see more than our share of lung cancers. Unfortunately, there's two factors that make Fond du Lac region very susceptible to lung cancers, which is, one is the high smoking prevalence. A lot of people do smoke. Actually, I guess there's three things. High secondhand exposure. And, you don't know how many people I see that say, "Oh, I've never smoked in my life," but they say, "Oh, my parents did, and so does my spouse." And then the third thing is radon. Okay, if you don't have remediation systems in your house, or if you haven't been tested for radon, make sure you do. And there's one thing that's very simple that you can do in the winter time is basically just open up the windows once a day, close them up. And that releases all the radon from your house. So it's easy enough to do, it's just cold. But because of the fact that the winters are so cold here, they insulate the houses so well that the radon has no place to go. So it accumulates in the house. So that's the other contributing factor. Okay, so these are the cancers that, oops, go back here, that the risk of which can be reduced with exercise that has been proven with studies. Okay? Again, prostate, lung, colon, rectum, breast, uterine cancers as well. And that makes up, as I said, about 50% of all cancers. That's a huge number, okay? So, this is basically shows you that cancer, as we age, there's more chance of developing cancer, which makes sense because you have a longer time for those cells to mutate to become something else into cancerous cells. So if we put cancer risk here on this axis and age on this axis, okay, as we age, that cancer risk goes up. And in fact, if any male that grows over the age of 90, basically you're guaranteed to have prostate cancer. Guaranteed. Which is interesting because if you read some of the Time magazine and Newsweek and things like that, they're saying that the babies that are born today are going to live to about 126. Now, 126 is a long time. So the male babies are going to have prostate cancer by the age of 90. So we're going to have to work with these 90-year-old babies to try to figure out, well, how do we manage their prostate cancer? Because they're going to be living another 30 years. So right now, when we see a 90-year-old and they have prostate cancer, we say, God bless you, have a happy birthday, we'll see you whenever. But it's one of those things, okay? So if this is cancer risk, this is the time that we exercise as we age, okay? So it's inversely proportional. Basically, we exercise a lot, and anybody that had small kids and you watch them, they're running. They're not walking. There's no kid that actually walks. I don't know if kids cannot walk, but they just run. And I have 4 kids, and I'm always amazed how they're running. And then we keep telling them, slow down, don't run, slow down. And then they probably start doing this, and then they start dragging their feet. So at any rate, all of us do this, and whether it's arthritis that we blame it on or whatever it is, exercise goes down, cancer risk goes up. Now, if you showed this to a high school student, and you would say, what do you think this graph means. Somebody would raise their hand and they would say, well, I think that the more we exercise, there's a lesser risk of getting cancer. The less we exercise, more risk of cancer. And that's kind of true. And this is what I want you guys to kind of ingrain in your brains as like, oh my gosh, there's possibly a correlation here, okay? And age, this is something that we cannot affect, okay? We're traveling down this path no matter what. Everybody is, no matter what we try, okay? This graph basically shows race for breast cancer, colon cancer, lung, prostate, and uterus. And some cancers are more related to race than others, okay? But there's risk factors that are modifiable and are not modifiable. I wanted to go over some of these. Age, definitely not modifiable. As I said, we all are aging right now. From the time that I began this talk, you're all a little bit older, so am I. Genetics, okay? Thank your parents, thank your grandparents, thank your aunts and uncles. That's something that we cannot modify, no matter what. Okay, family history, whether you like it or not, Uncle Bob is part of the family, you cannot disown him. It happens, okay? And that's not a modifiable factor. Gender, okay? You can switch your gender, you know, people do it, but what's inside those cells, the chromosomes, you cannot alter that. So we do see male breast cancer. We have yet to find a female prostate cancer. Maybe it'll come. But these are not modifiable factors. Okay? These things here, tobacco, weight, diet, exercise, are modifiable. These things that we can actually have control over. Okay? So and this gets me every single time, if somebody said to you, you know, you're buying a house, let's say a kid in college, you say, 10 years from now you're going to buy a house. What if I tell you today, if you exercised 20 minutes every day for those 10 years, I will reduce your mortgage payment by 20% for the rest of your life. For the rest of your life. Oh my gosh, everybody would be like, are you kidding? Of course I'm going to exercise every single day. If somebody tells you, I can reduce your chance of getting cancer by 20%, 10 years, 20 years, 30, I'm not interested. No thanks. But when you put money on the table, you're like, oh yeah, sure, I'll do it. So, exercise, okay? More than 50% of Americans do not exercise regularly, okay? So, 2/3 are overweight or obese. Now, we can talk about what does obesity mean, what does overweight mean, and everybody looks at the BMIs and they're like, what? I don't know. I mean, I'm considered overweight based on the BMI. The problem is that BMI does not include muscle mass. So BMI is basically your height, your weight, and that's it. If you take a pound of fat and a pound of muscle, you have to have a big ball of fat for a little piece of muscle. But at any rate, 2/3 of Americans are overweight or obese. Probably is a little bit lower than that. And 1/3 of all cancers are linked to diet and physical activity. That's a big number. Okay, 1/3. How much exercise? What are the recommendations? The CDC recommends moderate to intense exercise, where basically they give you a formula. And it looks very complicated, but it's not. Okay? Heart rate, 220 minus your age, and then half it. Okay? So if you're 50 years old, basically it's 220 minus 50, then half it. 85 beats per minute is what is considered moderate to intense exercise based on your age. Okay? Vigorous to intense exercise is a little bit more. Okay? So 220 minus age, and then 3/4 of that. So again, if you're 50, 220 minus 50 times 0.75, it's 127 beats per minute. And actually, if you ever get on a treadmill or anything like that, these numbers are there, and they're usually, say, 60% of your age recommended heart rate, 80 or 85% recommended heart rate. So you can figure out where you want to be. So CDC recommendations, 150 minutes per week if you're doing moderate exercise, 75 minutes per week if you're doing vigorous exercise. Now, some people say, well, I don't have 150 minutes. So then they can go into the vigorous exercise program. Other people say, you know what? I can't do a vigorous exercise. I'm going to do more moderate exercise. Then you have to put yourself in this. So at least 30 minutes more than 5 times a week is for moderate. Okay. They recommend at least 20 minutes more than 3 times a week for vigorous exercise. So you can think in your mind's eye, you know, how much do you do? Where do you fit it? These are recommendations. Okay. So, kind of getting to the bulk of the topic, with a little bit of data and how can this happen. So again, for breast cancer, new cases in the United States, 234,000 new cases. In Wisconsin, 4,300, as I pointed out before, and the deaths in Wisconsin are 720. Okay? So more than 60 studies have been done looking at breast cancer and exercise. Basically, cancer reduction with exercise ranged from 20 to 80%. That's a huge range. Usually when it's a range that's this big, what that means is that it's an imperfect study. Okay? But notice, no study was 0%. Okay? No study said, oh, this will, you know, there's absolutely no correlation. At least 20%. Some of the studies showed actually 80%. Okay? The benefit is for both premenopausal and postmenopausal women. So if you think you're out of the woods and say, oh, exercise is not for me, I'm postmenopausal, or oh, I'm premenopausal, who cares? It actually, you will benefit no matter what. Okay? And their benefits are seen regardless of your BMI. So whether you're heavy set, you have a high BMI, or a low BMI, the benefits for breast cancer are seen. Okay? They start in adolescence. Okay, and we should not forget that. You know, we encourage our kids to exercise, and then we kind of say, well, do whatever you want to do later on, but we stop encouraging them, and I think that's wrong. We should continue to have them exercise, and if they see you exercising, if you have small kids, they're more likely to start. And so I already talked about the menopause. 30 to 60 minutes of moderate to vigorous exercise daily is needed for benefit. Okay? You may say to yourself, oh my gosh, how am I going to find 30 to 60 minutes a day to do that? Okay? Well, ask yourself, how did you find 30 to 60 minutes to listen to somebody like me talk on and on and on about this topic? There are, and I'll talk about this a little bit later, but there are chunks of time in your daily lives that you can probably allocate to this, because I think it's important, because I don't want to see any of you in the cancer center, although I know that I see some of you in. So the proposed anti-cancer effect for breast cancer is it lowers blood estrogen levels, especially in the postmenopausal women, meaning the more exercise that you have, it actually will lower the female hormone. Most of the breast cancers that we see are estrogen and progesterone positive. Okay, so the hormone estrogen, which is a female hormone that no matter what, even postmenopausal women have, that's what makes you a female. And actually even men have to some degree. Basically, fat is able to produce estrogen. Okay? The more fat you have, the more estrogen you have. And you've probably heard that before. But exercise will actually lower your fat level, will lower your estrogen levels, so that the fuel to the fire, those estrogen-positive cancers, is going to be decreased. It also lowers insulin levels, and that's true for anything. There have been studies that show that the higher your insulin is, the more likely you are to develop a whole bunch of cancers. improves immune response, okay? And that's also true for other cancers. And more, we're looking into chemotherapy drugs or immunomodulators. Basically what it is trying to get the body to fight the cancer, okay? If you can do that with exercise, you're giving that an extra boost. Okay? And then this is that lower body fat, lowers estrogen levels, as I spoke about before. Okay, what about colon cancer? New cases, 132,700. New cases in Wisconsin, 2,400. Deaths, 850. Okay, more than 50 studies. Okay, and cancer reduction with exercise, 30 to 40%. Again, the benefits are seen regardless of your BMI. Doesn't matter where you fall on that spectrum today. If you start exercising, you will see that. Greatest benefit in most active individuals. More exercise, more benefit. 30 to 60 minutes of moderate to vigorous exercise needed for the benefit. So if you do this 30 to 60 minutes, if you're a woman, breast cancer and colon cancer risks are reduced. Not by small numbers, okay? So proposed mechanism for that, okay, stimulates hormone metabolism, okay? Basically any hormones, insulin and other hormones that I was talking about that may actually contribute to causing cancer. It decreases the time of colonic mucosa exposed to carcinogens. Exercise actually stimulates our gut. While we exercise, it does not. It actually takes the blood out of our gut and puts it to our muscles. But then all of that blood that's been pumping, that's been doing all this stuff, gets rushed back into the gut. And basically, you can have a colon cleanse with exercise, as it were. Because all of a sudden, it's a lot more active. Your gut is going to be a lot more active. And that's one of the ways that exercise actually promotes weight loss, is that it stimulates your gut. Things aren't just sitting there. Okay? And then alter inflammatory and immune factors, just as I spoke about for breast cancer as well, so that your own body can fight some of these cancer cells. Now, one thing that some people are surprised by, and I want to mention this here, cancer cells are your own cells, okay? They're just mutated cells. They're cells that have stopped working normally, okay? But they're your own cells. Nobody gave it to you. There's no such thing as, oh, somebody gave me cancer. I mean, it just happens. So when those cells mutate, they basically lose the ability to die, okay? So they live on forever. As we age, the cancer cells basically lose that the ability to die. Okay. So what about prostate cancer for the men in the room? 220,000 new cases in the United States, 4,300 new cases in Wisconsin, and 590 deaths each year. Okay. More than 30 studies were done on that, and there's a questionable benefit, especially for men over 65. And the question is it because we see prostate cancer beyond that age? There aren't that many patients that are young that get prostate cancer. It doesn't happen very, very often. But it's possible that the older you are, the more the exercise will actually benefit. And the amount of exercise for prostate cancer is unfortunately not been established, which I think is very interesting because prostate cancer is so prevalent that they haven't done more studies to actually look at that. But proposed anti-cancer effect, again, altering hormone levels, okay, controlling your PSA and such, lowering insulin-like growth factors. Again, that insulin being out of control can actually stimulate cells to grow and to mutate and things like that. And again, increasing immunity and antioxidant defense mechanisms. Okay, what about lung cancer? And this is like I said, it's an interesting cancer for me to talk about because we just see so much of it here. 221,000 cases in the United States and 4,300 cases in Wisconsin. A lot of deaths. Unfortunately, most of these patients do die. And it becomes really heartbreaking when you have to tell somebody that they have lung cancer that's terminal. More than 20 studies were done. The risk reduction is huge, 20 to 40%. And I'll talk about why that probably is on the next slide. But it's very, very interesting that this is a big, big number for a preventable, potentially preventable cancer. Okay. Risk reduction for women is less clear than for men. I believe that's because we haven't seen as many women with lung cancer as we have with men. If you remember that graph that basically had that peak for men, where it basically was a lower peak for women. But I believe it's both. Okay? The amount of exercise has also not been established for. But it's interesting. So no clear mechanism for anti-cancer effect with exercise for lung cancer. However, the proposed effects are very, very interesting. In addition to altering those hormone levels, as I spoke before, and lowering the insulin levels, and increasing immunity, there's a really high likelihood that the more you exercise, the less you're going to smoke. It's very hard to be on a treadmill or running around with a cigarette in your mouth. It just doesn't work. I mean, you can run to the grocery store, pick up a pack of cigarettes, smoke it, and then try to run back. But it just doesn't work as well. And I actually had a friend in college who used to smoke as like a chimney, and then he got to liking of a girl, and she was an avid runner, and he's like, oh, I'll wake up early and I'll run with her. So he did that, but basically he was only about to run half as far as she was ever able to run. So he gave up smoking for the girl, and he hasn't smoked since, but he continues to exercise. So that's a good thing. But he found out very quickly that he can't do both. He can't smoke and run with this girl at the same time. And the other thing is an increased clearance of inhaled carcinogens with aerobic exercise, meaning we're all breathing in carcinogens. As we're standing in here right now, despite all the filtration devices and everything else, there could be carcinogens that are entering our body. 99.99% of the time, we get rid of them, we cough them up, whatever. But you have to imagine that as you exercise, your breathing rate goes up, your blood flow goes up, the filtration mechanism improves vastly instead of just sitting there. And we've all seen this, even with infections and pneumonias and things like that. Patients that are sedentary, patients that are in the hospital, sitting there, not moving too much, they get stuff in their lungs. They can't cough it up. Their lung function is not so good. If you exercise, your lungs are basically very efficient. They're very efficient at getting rid of the carcinogens that we breathe in on an everyday basis. So this is a good method. Okay, what about endometrial cancer? 44,870 new cases in the United States, about 1,100 cases in Wisconsin. A relatively low number of deaths. We do a relatively good job in treating these cancers. But again, over 20 studies have been done. Risk reduction 20 to 40%. Again, that's pretty good. Most benefits of women who exercise more, and that's, again, true regardless of age. Endometrial cancer is a cancer of postmenopausal women, usually. Women come with postmenopausal bleeding. That's how we usually find it. But that benefit is seen all throughout the entire lives. And the amount of benefit or how much exercise you need has not been firmly established for these cancers. Okay? No clear mechanism for endometrial cancer. The proposed is, again, lower estrogen levels. Okay, as we lower the estrogen levels. This is similar to the breast cancer that I was talking about, where estrogen receptors on those cancer cells are being fueled by estrogen. Okay, lower body fat, lower estrogen levels. Same thing as for breast cancer. Okay, and so again, you don't need to do exercises for each one of these cancers. Basically, one exercise takes care of it all, which is really very nice. Okay. What about patients that already have cancer? Is there any benefit? Okay. And then what about the patients that survived cancer or are in remission. Okay? The benefits are seen no matter if you don't have cancer, if you have cancer, or if you're past cancer treatments, undergoing treatments, doesn't really matter. Post-operative healing is improved with exercise. And it used to be the case that the surgeon would tell their patients, no vigorous exercise for as long as you don't feel well. No exercise at all for however long. Those times have really got shorter and shorter. And we're trying to get patients physical therapy, occupational therapy, out and going about. It's not because of cancer risks necessarily that the surgeons are thinking about it, but basically because of improved post-op healing. You get more blood flow into those organs and it heals better. Improved oxygenation of tissues during chemotherapy and radiation. I can't stress this enough. Chemotherapy and radiation work by oxygenation. If you have well-oxygenated tissues, what happens is free radicals form. That's good for us, okay? And they damage the cancer cells. Okay? The more oxygen you have in there, the more free radicals that we have that can actually fight this cancer. So very often, I encourage patients, get up from your chair, walk around. Okay? It may not always be possible in the dead of winter, but we have the mall that's still open that you can walk around there. Okay? Get yourself a treadmill. Get yourself a stationary bicycle. Whatever it is, take your grandkids, take your spouse, take whoever that wants to come along and exercise, okay? And then we have seen reduced side effects, okay? Faster metabolism of toxins. Chemotherapy, people tell us all the time, oh, it's poison, it's poison, it's poison. Well, that poison is killing your cancer, but it's also damaging your healthy cells. Your healthy cells can regenerate, but they can regenerate a lot quicker if they have more blood flow to the organs and if there's better filtration, okay? Weight control, okay? Once again, most or a lot of patients that we treat may or may not have a problem with insulin or weight control and things like that. Exercise can control that. Reduced fatigue, and we see this all the time. Patients that are on chemo and radiation and post-surgical patients are fatigued. It's a lot to go through. If you exercise, we've seen that fatigue actually goes down significantly. Or at least we have another thing to blame it on. Say, no, it's the exercise you're doing, that's why you're fatigued. Reduced depression. Again, a lot of patients, obviously, have depression with the diagnosis of cancer. Exercise has been shown to increase endorphins, which basically are body's mechanism to fight depression. And also you'll feel well, you look better, etc. With exercise. Okay? What about for survivors? Benefits are an improved quality of life. So I've had patients that tell me, oh my gosh, the time that I wasn't able to exercise was terrible. You kind of just sit there and you look at the TV and you think to yourself, is there all there is? I fought cancer, I'm doing so well. I tell them, go and join the gym, go and exercise. Get out of the house, you'll feel so much better. Again, the reduced fatigue. And there's actually improved survival with breast cancer compared to sedentary women. Meaning, if you were diagnosed, treated, the women that pick up an exercise regimen or continue to exercise, their survival benefits with exercise. That's nothing that I did, that's already beyond that. And it's seen in those estrogen-positive tumors. Again, you're lowering the estrogen levels, so there's less chance of developing a secondary cancer or recurrence because of that. Okay? And then decrease the recurrence rates and improve survival in colon cancer patients as well. And again, I think it has to do with the fact that your colon is working a little bit better to get all the carcinogens out of your system. Okay? And again, look well, feel better. Who doesn't want to look well and feel better? Okay? So in conclusion, okay, the battle of cancer has been fought for millennia. Okay? We're not new to this, and it's going to be fought for millennia. People that say, oh, we would love to find a cure for cancer. That would be terrific. Unfortunately, the body is not designed that way because things happen in our bodies all the time. Our hair keeps on growing, our nails keep on growing, cells need to be able to divide. So although we love to find a cure for cancer, I don't see it on the horizon. Improved outcomes with today's treatments, okay? We do a relatively good job with most cancers. We can actually have patients live longer and better lives, okay? Cancer development is multifactorial. There's things in our bodies that we cannot change, as I talked about. Our age, our gender, family history, genetics, etc. But then there are things that we can do something about. Exercise, eating right, stopping smoking, drinking in moderation, protecting your skin. These things you can actually do for yourself to prevent cancer, okay? And there's also benefits, as I mentioned, in patients undergoing treatments and in survivors, okay? So I asked you guys the question before about the superhero. Which superhero do you want to be? This type or this type? Which superhero is going to be more effective at treating your family, treating your patients, your community, actually getting out there and doing whatever you need to do? I know nobody in their mind's eye had these as their superheroes, okay? Possibly somebody had those. Thank you very much.
Thank you.
Any questions?
I
Yeah.
was surprised to see how high, when you showed the whole historical map per capita, how high Wisconsin was for cancers.
Yeah, it's interesting. I think people forget. I think lung cancer in Wisconsin is high. I mean, I trained out on the East Coast in Pennsylvania. People do not smoke out on the East Coast. It's no longer cool. West Coast, same thing. My sister, who's out there, basically, she used to smoke. She moved out to the West Coast. She quit smoking and started exercising. It's kind of the lifestyle. I don't know whether people aren't getting the memo here that smoking is bad for you. When I started, it's interesting. When I started medical school, the first thing that I learned, I sat down at the desk. This rheumatology professor comes out, a physician, and he writes on a board, knowledge does not change behavior. He underlined it. And to this day, it's true. That's why all the data that I can show doesn't matter. If I can't motivate you to go out there, exercise, stop smoking, and doing all these things, if I can't do that for my patients, any numbers that I quote have absolutely no meaning. Knowledge does not change behavior. When I went to business school, I asked one of my professors there, I said, well, I was taught that knowledge does not change behavior. Now we're sitting here in the classroom, we're trying to learn something, and all through medical school, I've been trying to obtain knowledge. What do I do? How do I present information to my patients? And he says, this is where motivation comes in. He says, you have to motivate them. You can't just tell them information. You have to basically be there with them and motivate them to do what they need to do. Because you can eat all the textbooks. You can have it right here. You can spit out any numbers that you want. If you can't motivate somebody to do, they will not do it, no matter what. So, any other questions? Yeah.
With the radon levels, is there a specific amount of time that you need to be opening up your house?
So that's a good question. It all kind of depends because radon is a gas. And as radon accumulates in your house, there has to be a draft, okay? And it doesn't have to be very, very long. But on a still day, how do you get the draft in there? Some people will turn on their air recycler or whatever it's called, during that time to kind of get the air moving. That's what I do. I usually turn on, open up all the windows, open up all the doors, turn on the fans. No more than a minute or two, really. And if you do it on an everyday or once a week, you can put it on your timer on your phone, and just, when nobody's really at home, just air it out, close them. The people down south don't have that problem because they always have the windows open. Here in the wintertime, we all close our windows because it would be ridiculous to have snow in your house. But you don't want to have radon either. So
how long?
a minute or two is fine if there's a breach. Any other questions, concerns, criticisms? No. All right, well, you still have 4 minutes. You can go and exercise.
Thank you, Dr. Troicki. Interesting presentation. If you get past your green slips down to the right, if you're interested in a chance to win this Agnesian bag. Put it here for good
Oh, sure, yeah.
She's scattering.
Sure. All right. Go. Chris Flanagan.
Oh, my
God.
Just put it right there.
I do not know this woman.
Well, thanks for being here this morning. Dr. Troicki will be back at noon, so if you could be so kind as to share that with your coworkers and help to fill the room again, that would be great. Have a great